I am so honored to return to Boulder to celebrate the partnership, the progress, and the hope all of us have for children and family in this community. In 2009, I received an email from Kit Thompson saying that the Housing and Human Services Department had just merged and wondered whether Casey would help them do this assessment about which Angie spoke of their child welfare system in this newly merged department. In a follow-up call, Kit said this. She said, "We aren't in crisis. We haven't had a child death rate lately or bad press. We have the lowest out-of-home placement rate in the state. We just think this is a good time to know whether we're doing all we can for children and families touched by the child welfare system in this community." And then she said, "If we aren't great, we want to be." So many times systems ask for help when they're in crisis or when they need to react to something bad that's happened. This was an unusual ask. After meeting with Kit and with Frank Alexander and child welfare staff, we began a journey of collaboration and partnership that remains strong today. We co-designed an assessment, and as many of you know, because you're sitting in this room, we held lots of interviews and lots of focus groups with stakeholders, with commissioners, with judges, with the legal community, with providers of service to foster children, to monolingual Latino families, to kin, to foster parents, to educators, to law enforcement, to mental health and public health leaders, substance abuse, domestic violence providers, public health, TANF workers, and all of the child welfare staff. And what we asked was, what's going right in child welfare? What do you think the mission is of child welfare? And what could they do better? What could we collectively do better? And how have you partnered with them? We met some incredible, passionate folks who offered great advice and actually strong affirmation for the child welfare system. And in the end of the process, we distilled the information into a few recommendations. Actually, there were 75. And when you do a report like this, sometimes people can put those reports on the shelf, but not the child welfare system, not DHHS. They took that report and began almost immediately to prioritize the recommendations and then to act on them. And over the last 5 years, they've actually significantly changed their system. They learned to engage with families differently and included them all along the way. What happened was that families received what they needed, but not just in the child welfare system. The safety net of all the partners and systems in Boulder County. And the child welfare, what we saw was that the child welfare system got stronger and the partners got stronger. Better and close to great. New partners emerged like the hospitals, like the community foundations, like all the people that were interested in making sure that no family touched by child welfare wouldn't get what they needed. And what is remarkable, really remarkable, is that all of this happened during an economic downturn nationally and here in Colorado, in the midst of terrible forest fires and floods, and a dramatic shift in the child welfare allocation from the state. Today, Boulder's child welfare system is a leader, not just in Colorado, but staff from Boulder and all around Colorado have provided help, TA, and support to 11 different states in the United States on what they've learned about how they've become a great system of care. Child welfare staff are working hard to ensure that all children live in a family, preferably their own, that youth have a place at the table and a forum to offer their advice. Child welfare staff and their management team today have 7 times more families in child welfare being served outside the system than they do in out-of-home placement. That support couldn't happen without the partners in this room and with each of you who care about making sure that Boulder County has a strong and safe safety net. Cases are not kept open to monitor families, but are only kept open if there's a need that can be mediated by a service or a support. Not all of this could happen, none of it could happen without a strong network. And today, 5 years later, and sometimes it seems like a million years later, and sometimes it seems like just a few minutes ago, but 5 years later, the child welfare practice model in Boulder County is strong. the organizational structure is efficient, and its leaders are empowering its staff to carry out its mission. So I'd like to acknowledge our thanks as Casey Family Programs, a strong partner here in Boulder County, to each of you for your leadership in this room. It couldn't happen without you. But I'd especially like to call out the child welfare staff in Boulder County. And I'd like to ask all of them to please stand so we can acknowledge them. If you're working... And I'd like to give a shout out to the managers, to Melissa Mailing, to Wendy Ingham, and to Terry Ryan Thomas. Would you stand so we can thank you too? And finally, I'd like to acknowledge Frank Alexander, the leader of DHHS, for all of his support and insight into child welfare and how it could become better. And to Kit Thompson, the Director of Family and Children's Services. And I'd like you both to come up here and receive our acknowledgement to you for all you've done as partners with Casey Family Programs and the strength that you bring to child welfare in general and nationally. So Frank, Kit. You're welcome. Thank you for all you've done for here for Boulder County, but for all of Colorado too, and for the impact that you're having nationally. It really means a lot. So if you stand next to me, you'll see that we can see. Come on up here. Okay. This. So this is the long and the short of it. So. Thank you so very much for your partnership and for all you do.
Thank you, Sue.